So Woven in Govan really at its absolute core is a project that is looking to commission artists to work with and respond to the stories of care workers during the COVID-19 pandemic. The idea really is to pair artists with different people in the care sector, so both NHS staff, but also people working in social care, people working as unpaid carers, and to find artists who can work within the public realm, to have those artists working with these stories, responding to the stories of care.
Concentrating specifically on this extra burden that's fell upon women yet again during the lockdown situation.
Especially during this kind of health crisis where you have women taking on teaching roles within their home, homeschooling, and just acknowledging that and making something in response to showing that we listen and acknowledging this kind of hard work that's involved.
Care is everywhere, and I suppose what happened in Govan seems to be, the more you look into it, it's a huge care community because nature has really been it for lots of people, I think. And there's really three things that have stood out a lot over the pandemic, the time, which is breathing, mental health and nature.
We think very much about care being about nurses and personal care, but there's so much care that goes on behind the scenes. Volunteers that come and work in the food bank, food is an act of care. It's really highlighted a very vibrant, caring community.
We're really looking at a loneliness that's, in itself is like an epidemic, and it's having those different generations that are feeling more isolated.
We've worked on kind of manifesto projects before, kind of bringing lots of ideas together to explore kind of that concept of a manifesto as a way of speaking out, as a way as kind of raising voices of people. Often people are not so well heard. What we wanted to do was speak to a number of people within Govan who are working in a variety of caring roles, to see what their kind of issues were, what mattered to them, but I think fundamentally what they wanted to see change.
They then looked at things like rest, time, just kind of giving them space, time and space and rest.
Slow rest. I get forced to rest and relax sometimes. My two older kids will make me, they'll just step in and say, "Mum, you're looking ragged, you're looking tired."
With COVID, it was quite a difficult to engage with people. Normally I would go and join in with different groups or volunteer or meet people in that way, but it was a very different approach. But I found once I actually was in with people in, say, the hospital or the food bank, gifting the soaps, it was very easy to begin to talk to people in that setting. And I suppose things had opened up a little bit more with it, in terms of being able to meet with groups by that stage.
It was really frustrating that we were not getting together, but the Zoom meetings were really helpful. It felt as if we were kind of coming through the same stages at the same time, so it was like overjoyed. I had a conversation with this woman, and it was, that normally those things would have just been happening, it'd all been part of our own processes, but it was great to have that support.
With making creative workshops online, it was a lot of preparation and organisation to get the materials out to the participants for them to draw on and then get that back. And there was a lot more milk cartons that were actually made, but I've only received back like a quarter of them, in fact. So that was tricky in itself,
Woven in Govan is the kind of project that I found it really inspiring. I think it's been really inspiring to work, to hear from and have the opportunity to speak to carers. So I think the issue of care and caring in communities is one that is more front and center now, I think in a lot of people's minds, quite rightly. And the question is just how artists can be useful within those conversations. So I'll be interested to see how that all continues on as we move forward.